Diabetes mellitus is a condition where the body cannot use glucose properly, so the levels of glucose rises in the blood. We need glucose for energy. Glucose comes from foods such as bread, potatoes, rice, couscous, pasta, sugar, honey, cakes and biscuits. It is also stored by the body in the liver. The glucose from the food we eat passes into the bloodstream. To use the glucose as energy, it must get into the body's cells. To do this, there must be insulin available. Insulin acts as a key in a lock. The insulin unlocks the cell's receptors and allows the glucose into the cells to be used as energy. In diabetes, the body doesn't produce enough insulin, or it is not able to use the insulin effectively. The glucose therefore remains in the bloodstream, and the glucose levels start to rise. When the levels start to rise, you will start to suffer from the symptoms of diabetes. Type 1 diabetes is a lifelong condition diagnosed mainly in children and young adults. It is often discovered when the person is acutely ill, needing to go to hospital urgently. Treatment is with diet and insulin injections. A person with type 1 diabetes usually has 2 or 4 injections of insulin daily. People with type 1 diabetes would die without the insulin injections, as their body has stopped producing any insulin. Gestational diabetes occurs only in pregnant women and requires women to have a strict diet and test their blood glucose levels very frequently. If diet alone cannot control the blood glucose levels, pregnant women also need to use insulin injections throughout their pregnancy. Once the baby is born, the diabetes may disappear. About 6 weeks after the birth, women who have had gestational diabetes will have a glucose tolerance test to see if the diabetes has reversed. Type 2 diabetes is a lifelong condition which is increasing in prevalence. Type 2 diabetes can occur in families, so if you have a family member with type 2 diabetes, you are at a higher risk of developing type 2 diabetes. Treatment of type 2 diabetes starts with diet and exercise, but it is a progressive disease, so with time, people may progress to using tablets or insulin in conjunction with diet and exercise. Type 2 diabetes can often be undetected for several years. So if you have or know anyone with the following symptoms of diabetes, it is important to get tested to see if the symptoms are caused by type 2 diabetes. When blood glucose levels are higher than normal, you can have some or all of these symptoms: feeling thirsty, drinking lots of fluids, passing urine more frequently, especially at night, thrush, blurred vision, feeling tired, weight loss. If you think you have diabetes or have some of the symptoms, you should visit your GP. Your GP will ask you some questions and send you for blood tests to help to diagnose diabetes. You might be sent for a glucose tolerance test. This test involves fasting for 12 hours overnight, then attending the hospital for 2 blood tests. After the first blood test, you will be given a sugary drink, and 2 hours later, the second blood test will be taken. The results of this test will tell the doctor if you have diabetes. If you don't have diabetes, the glucose tolerance test will inform the doctor if you have impaired fasting glucose or impaired glucose tolerance. Both these conditions are important to know you have, as your risk of heart disease is increased with both these conditions.